The medical equipment scheme was a push by the national government to have the modern equipment in every county, but at what cost? Some counties had initially rejected the equipment, questioning lack of consultation by the national government and the amount of money each county was to cough to sustain the leasing of the equipment. So far, medical equipment in more than half of the counties are gathering dust in stores because they do not have trained personnel to operate, lack of space, and in counties like Samburu, West Pokot and Baringo, there is no sustainable power to run the machines.
For example, in Vihiga, in a place called the Muhaya, where they brought this big machine called the C-arm. They don't have an orthopedic surgeon. Actually, that hospital does not have a doctor. Is that value for money?
We have in a few cases machines not being matched with requisite HR to be able to operate them optimally.
The medical equipment services scheme was either not well thought out or it was deliberately done to almost swindle our counties.
Kericho County is one of the counties where the equipment are fully in operation, begging the question, why not other counties?
We didn't have the radiology experts. Yes, we had the doctors, but maybe they didn't have the capacity to interpret the images. So we had to do quick trainings. We had to send them out of the country, and locally we had to send others to MTRH, others to Kenyatta National Hospital.
The renal unit, we've had good success as well, but there is a big challenge in terms of supply of consumables.
Even consumables are being leased, trolleys are being leased at a higher cost than the actual purchase cost of those equipment. Why would you lease a stretcher?
Governor Professor Chepkoech says the county had to go outside its budget to hire more doctors and technicians.
This is revolutionizing health sector in Kenya. In fact, before devolution, patients used to be referred to private hospitals. Now the private hospitals are referring patients to the referral hospital.
You will find that many people are dying because getting cancer treatment is a problem.
At the radiology center, services are fully booked for the whole year. Services locals used to get in provincial referrals and in Nairobi.
The CT scan in Isiolo County is not working. Yeah? Secondly, there is something called spirometry. I don't know what it means. It's not working.
Isn't it an act of gross negligence for the ministry and the national government to supply equipment to units they know have no personnel, have no water, have no electricity?
Provision of water, electricity, training to ensure optimal utilization of equipment is an obligation that the counties signed themselves onto.
Counties initially paid 94 million shillings each, but that amount has since been revised, with each county now paying 200 million shillings. An amount the Senate has protested, with the House demanding stoppage of payments to counties that have not used the equipment. So far, the government has coughed 18 billion shillings, with 28.7 billion shillings out of the total 43 billion shillings yet to be cleared. Senate demands that health being a devolved function, leasing equipment on behalf of counties undermines the doctrine of separation of powers. When Kericho County received the equipment in December 2016, some sub-county hospitals were not in a position to house the CT scan and the radiology machines.
This money, which was used to procure MES equipment, is in fact an allocation to county government, which has been given as conditional grant. The only thing that happened is that the national government procured on our behalf. And the naysayers should never dream that it should be clawed back to the national government. Health is better under counties right now. You've seen, you have testimonies from Kericho to other counties. So all we need is the requisite funding.
Governors in their protest lamented that the national government did not factor in personnel to run the equipment, as well as specific needs for each county. 2 years after the supply of the medical equipment to various counties, some counties have shown success in the use of the equipment, while other counties have indicated or reported failure in one way or another. What counties now are gearing to do is to ensure that they streamline the medical equipment services in the county level to ensure that the health docket is fully devolved at the county level. Stephen Leto reporting for Citizen TV at the Kericho County Referral Hospital.